California is averaging 22,000 confirmed COVID-19 cases per day, but epidemiologists say the true number could be much higher. Good evening, I'm Jesse Pagan in for Marcella Lee.
I'm Carlo Cicchetto. COVID is obviously still here, but as Morgan Reiner tells us, a New York Times poll last week had less than 1% of voters listing it as a top priority.
What does COVID look like right now? Well, it depends who you ask. One epidemiologist told me that the reality is in this country is that we could be seeing up to 1 million cases per day if the reporting numbers were accurate. Another health expert told me that may be true, but the severity of the cases are just so low. UC Berkeley School of Public Health professor John Swartzberg said he gets it.
I'm tired of the pandemic. I'm had it up to here with the pandemic.
But he said to look beyond the numbers to understand just how fast COVID is spreading.
A good way to know how many people are getting sick right now is to just ask yourself, do you know anybody with COVID right now? And already this morning I've talked to 2 friends. So it's pretty prevalent.
Cases and hospitalizations are rising in California, not deaths.
That's where the good news is, relative good news. By that, I mean the number of people dying in the United States now are 300, 350 people a day. But multiply 350 or 300 by 365 days, and you're getting big numbers. Leading cause of death in the United States.
But USC public health expert Jeffrey Klossner said it's hard to trust the death count.
There was actually a report that came out on Friday from Los Angeles County Hospital where they have 24 people in the hospital that tested positive, but none were actually there for pneumonia or COVID symptoms. So our hospital data are very inaccurate, and that also means that our mortality or death data is not accurate as well.
I asked both, should people be concerned?
It's become very rare for people who test positive to end up in the hospital, to end up with severe COVID. And that's because the majority of the population has either recovered from prior infection or been vaccinated. And that immunity is very good at protecting people against severe outcomes.
I am concerned that there are a lot of people who are going to wind up getting long COVID. And we don't know what that's going to mean for the next year, 2 years, or the rest of their lives.
Both added that people with increased risk, like cancer patients, should be more concerned, but also added the vaccine works very well for them as well. Now, they told me there is a new vaccine expected in the fall that's supposed to help not just with the severity of the symptoms, but to prevent people from getting COVID in the first place.